Pertaining to the charcoal, I noticed I carry around the charcoal.
Yes.
I noticed that there's an expiration date. How good is that past the expiration date?
Boy, I think I would, just to be safe, I mean, a lot of these dogs, they mean the world to us. And side effects of charcoal, it's probably on there because the FDA says, okay, it's got to expire in 5 years just because. It's probably okay, but you know, I wouldn't take the risk. I would throw it out. It's fairly inexpensive, and for as valuable as these pets are, it's kind of like using expired medications, aspirin. Yeah, it's probably good, but you know, it's $3 for a bottle of aspirin or whatever. I would renew it. If you're in an emergency situation and you're stuck and you haven't used your first aid kit in years, and you're like, great, it expired a year ago, I would probably, this is totally off the record, I would probably go ahead and use it for my own dog if the risk was substantial. I mean, really, it's not going to hurt that much. But definitely, and that's one reason to potentially just check your first aid thing, kind of like checking the lights in the, well, I'm from Oklahoma, so we have tornadoes all the time. So we have a stash, you know, we have all our, there's water, there's flashlights, etc. So we check those on a yearly basis, kind of like checking your smoke alarms. Check your first aid kit, make sure that it's up to date, nothing's expired, that type of stuff.
And also, if I don't have charcoal readily available or peroxide, and my dog ingests heroin or cocaine or something like that, is there something else that I could use to... There's
not a great way. There is a dosage for salt that you can give, table salt. You can run into some complications with that, though, from salt toxicity and salt poisoning, especially if they don't vomit it right back up. I can, you can get my email. If you want to email me, I can get you that dosage for the salt toxicity or the salt to induce vomiting. Those are really the best ones to use. We don't use ipecac syrup or anything like that typically anymore. So the hydrogen peroxide is readily available, and then that's probably the easiest way to do it. And then the activated charcoal. Now remember, if they ingest something like heroin or if they ingest something in large amounts, we're going to get that up before we give them the activated charcoal. So it wouldn't be a substitute for making them vomit. There are no great substitutes, and typically dogs have a great gag reflex. I mean, you won't be able just to stick something down their throat and institute a gag reflex to make them vomit. They just won't do it. So I think you have to use either medical, like we use like morphine derivatives and stuff like that in the hospital, or using the hydrogen peroxide. Absolutely. Use the peroxide. Make sure their stomach is clean, cleared out. Then give the charcoal. The charcoal is kind of like a second, you know, going out there to try to scavenge anything that might be left and prevent the absorption of anything that wasn't vomited up.
Now I know I won't have a lot of time if it's something like heroin or cocaine. So, I mean, how much time am I talking? I mean, should I bother with that, or should I try and get into a medical facility right away? If
you're around that stuff a lot, I would try to have a bottle of peroxide in your car. Okay, I would keep that. I wouldn't necessarily. Well, if you've got that there, I would go ahead and induce vomiting immediately and then head to the veterinarian. I would definitely try to do it first because it's oftentimes successful to give them the hydrogen peroxide. So I wouldn't necessarily wait. The other is that each of these drugs, especially when we're talking narcotics, are going to have different absorption rates. We know that if it is within the stomach and if it's like 4 hours after ingestion, it's questionable whether it's effective to do a vomiting or not. Typically, we'll just charcoal those patients. In your situation, though, when you see them eat it or you've been through a raid or something and there's a high suspicion that within the past few minutes or so that they've ingested the toxin, then I would definitely go ahead and do the peroxide before they leave and before going to a veterinary hospital. If they haven't vomited, we can always give them other drugs to try to make them vomit. Worst case scenario in a hospital, we'll actually put them under general anesthesia and wash their stomach. We'll pass a tube and empty their stomach that way.